Patient's vision be affected?
They should expect that the vision will be blurred, especially for the first week, because they're going to be instilling lots of drops in ointment, and there is a degree of inflammation as well.
And what about when can they return to their normal activities?
It's sensible, if you are working, depending on your work obviously, that you take 1 to 2 weeks off work. I'll always advise patients that they should keep the wounds dry. So when you're washing your face, use a flannel to wash round the face and avoid the eye area. If you have to wash your hair in the first week, just make sure you wash backwards so that you can keep the area dry. And we give antibiotic ointment to be used on the wounds to keep the wounds infection free and comfortable, and to keep the stitches soft. So with regards to using your normal face creams and lotions, I would tend to avoid that for 2 weeks, in addition to avoid wearing makeup.
Yeah, because that's what I would like to ask.
Yeah, most women do. When do they wear makeup?
Yeah.
So I would say 2 weeks, and at least to wait until we see them for the post-op visit, which is usually at about 7 to 10 days. And it's at that point we would take their stitches out. So it's better to avoid makeup until we see them back, make sure the wounds are healthy. I'd also advise that they should avoid strenuous activity, so no heavy lifting, avoid swimming, and anything where you feel that you are overly exerting yourself, it's better to avoid for the first couple of weeks.
Like a little easy to be with. What about scarring? Because that's the first thing they'll be asking. Will I have scars? Will I notice them to begin with?
So we always aim to make the scars, we try to disguise them as much as possible, and because we utilise your natural skin crease, the results are they look very natural, and they would tend to fade more and more over the first 6 to 8 weeks. So if in younger patients where the excess skin isn't excessive, we'll always try and keep the incision within your bony socket. And that's really important, particularly if patients have Botox for their crow's feet, because you really don't want to give them a scar that extends outwards, because it's much more noticeable. In the older patients, where you're doing it for more functional reasons, and they've got that hooding where they've got the peripheral vision impacted, then we might need to extend that excision out. But we'll always try and fit it in with your normal skin creases so that it looks as natural as possible.
Yeah, because that's what you want to keep it natural, isn't it? Because loads of patients will worry about how will they look afterwards, will they look themselves? So what would you say?
Well, this kind of surgery, unlike other surgery and perhaps dermal fillers, it shouldn't change the shape of your face. The aim of the surgery is simply to restore the youthful look of your eyelids that you had perhaps sort of 10, 20 years ago. Yeah.
So will they look pretty symmetric?
It's very hard to promise patients that they'll look symmetrical, because most of us have a degree of facial asymmetry, unless you're a model or Harry Styles.
Not many of those.
No, not many of those. So, you know, it's really important in your assessment prior to the surgery that you recognise that asymmetry. Sometimes patients have got asymmetrical eyelid heights, they've got asymmetrical eyebrows, and you have to take that into account too. And sometimes they might need additional treatment to improve their symmetry, and we've discussed that all at their initial assessment. That might be additional surgery, or it could be with adjuvant Botox treatment, just to give them a better symmetrical cosmetic result.
It's just so important, isn't it, that initial assessment? But wow, this is a lot of information to take in, isn't it?
It is, it is, and often it's quite overwhelming for patients. So we ensure that at their initial consultation and at their pre-assessment, they have written instructions and information, and we have a blepharoplasty pack that they can take away with them. Because often you don't retain all that information that you get on the day. It's a little bit like directions. You hear the first sentence and then you switch off. And then after the surgery, we also give them written instructions, all the medication that they'll need, and the information about their follow-up appointments.
Oh, sounds great.
Yeah.